Hold up your hand right now. Look at your fingernails. Not a quick glance, a real look. In the next few minutes, I'm going to show you something most people over 60 have never been told. Something cardiologists use every single day, but almost never explain to their patients. Your fingernails are quietly recording what your heart and your blood vessels are doing. They have been doing it your entire life. And if you know exactly what to look for, they can warn you about a cardiovascular crisis before it ever happens. I am Dr. Henna Stephen. I have spent most of my career in preventative cardiovascular care for adults over 60. And I want to tell you something that genuinely bothers me after all these years. People come into my clinic after a heart attack, after a stroke, and when I examine their hands carefully, the warning signs were already there. Sometimes months before the event, sometimes years. Nobody had noticed. Nobody had told them what to look for. Their bodies had been sending signals the whole time, sitting right there at the ends of their fingers, completely ignored. That ends today. Before we go further, I want you to do something in the comments right now. Type your age and tell me whether anyone in your family has ever had a heart attack or a stroke. I will explain exactly why that matters before this video is over. And stay with me until the very end, because the last sign I cover and the test I am going to ask you to run on yourself are the ones that stop people cold every single time. Now let me give you the biology in 30 seconds, because once you understand this, everything else makes sense. Your nails grow from a structure called the nail matrix, which sits just beneath the base of each nail. The cells in that matrix are in direct, constant contact with your bloodstream. They are nourished by the tiniest blood vessels in your entire body, the capillaries running beneath your nail bed. Because those vessels are so small, they are among the very first structures to show stress when your cardiovascular system starts to struggle. Think of your nails as a live monitor your body has been running quietly every single day for your entire life. After 60, this matters even more. In your 30s, your heart can quietly work around early dysfunction for years, and nothing visible happens. But after 60, those reserves are thinner. Warning signals appear earlier, and your nails are often where they appear first. The problem is that a typical 15-minute doctor's appointment cannot cover everything. Nail examination almost never makes the priority list unless something is visually alarming. The information exists in medical research. It just never makes it to the person sitting at home who actually needs it. That gap is exactly what I want to close for you today. The first sign I want to walk you through is called Terry's nails. This is not a term most people have ever heard, but once you know it, you will look at every pair of hands differently for the rest of your life. Look at your nails right now. Is the surface an opaque whitish or very pale color, almost like frosted glass, with a narrow strip of pink or reddish color at the very tip, just a few millimeters wide? That strip at the tip is the defining marker. That is what separates Terry's nails from an ordinary pale nail. And here is why it matters. Research published in Cardiovascular Medicine has identified Terry's nails as significantly associated with coronary artery disease, heart failure, and diabetes. One study found that people with Terry's nails had an odds ratio of over 6 for coronary artery disease, 6 times more likely. That is not a minor footnote. That is a major signal. Every condition linked to Terry's nails shares one thing in common. They develop slowly and silently over years before anything dramatic happens. I had a patient I will call George. He was 71 when he came to see me. No dramatic complaints. He felt reasonably well. He had been a little more tired than usual, which he blamed on age. We all do at some point. It is the easiest explanation in the world. But during the exam, I noticed his nails looked unusually pale with that characteristic reddish strip at the tip. I asked him some careful questions. He said he had not noticed anything on his nails specifically. He had simply accepted feeling a little slower. I ordered an echocardiogram. The result revealed early-stage heart failure that had been developing quietly for close to 2 years. No dramatic symptoms, no chest pain, no shortness of breath that he could not explain away. Just tired. Just gradually adjusting to a new normal without realizing anything had shifted. George is doing very well today because we caught it when we did. The door that opened that entire conversation? His nails. The second sign is called Lindsay's nails, and this one has a very particular appearance you will recognize immediately. Check your nail again. Is the half closest to your cuticle white or pale, and the half closest to the tip a brownish red color? Is there a sharp, clear line dividing the two zones? That is Lindsay's nails, sometimes called half and half nails. Half white, half brown red, sharp line between them. Lindsay's nails have been associated in clinical research with heart failure and liver disease, appearing after the body has been under sustained circulatory stress. Like Terry's nails, the underlying message is the same. Blood is not reaching your smallest tissues the way it should. Both signs are visible in ordinary daylight without any special equipment. Hold your hand under good natural light right now, and you can check for both in under 30 seconds. But here is what most people miss. These changes do not appear overnight. They come on slowly, over weeks and months. Your eyes adjust. You stop seeing what is actually there because your brain decides it is normal. You have looked at your hands every day for 60 or 70 years, and the gradual shift disappears into the background. That is exactly what makes these signs so dangerous, and exactly why knowing what to look for right now, while the descriptions are fresh, matters so much. The third sign is something called Mierke's lines. Run your finger across your nails right now. Feel for any horizontal ridges or bumps. If you see multiple white horizontal lines running across the nail, parallel to that small crescent at the base, but you cannot feel them with your fingertip, those are Mierke's lines. You can see them clearly, you cannot feel them. They are a visual signal, not a textural one, and that distinction helps separate them from other types of nail changes. A study examining nail findings in cardiovascular disease found that Mierke's lines were a statistically significant predictor of heart failure, with an odds ratio approaching 6. The presence of these lines made heart failure substantially more likely. They reflect low albumin levels in the blood, a marker that the body has been under prolonged nutritional and circulatory stress. When the heart struggles to circulate blood efficiently, the nail bed is among the first places to show it. I had a patient named Margaret. She was 68, active, not overweight, no symptoms she could put her finger on. She came in for a routine visit and mentioned, almost as an aside, that she had noticed some horizontal lines on her nails over the past few months. She figured it was probably nothing, just aging. I looked carefully. I recognized Mierke's lines across several fingers. I ordered a cardiovascular workup. We found early heart failure, entirely manageable at that stage. Her body had been asking for help for months, and she had almost convinced herself it was not worth mentioning. She is doing well today. But I think about how different that story could have been. The fourth sign is called Bow's lines, and this one tells a very different story from everything I have shown you so far. Where the previous signs build gradually over time, Bow's lines appear after a specific event. They are horizontal grooves you can actually feel when you run your finger across the nail. Not lines you see but cannot feel. Grooves you can feel and see, often appearing across multiple fingers at once. When the body undergoes a significant physiological shock, a heart attack, cardiac surgery, a severe infection, the nail matrix briefly stops producing new tissue. Growth halts. When it resumes, the pause leaves a groove behind, like a timestamp pressed into the nail. That groove tells you when something serious happened. What makes Bow's lines clinically critical is that they can reveal a past cardiac event the patient themselves may not have recognized. Silent heart attacks are far more common than most people realize, particularly in older adults. Symptoms get dismissed as a bad flu, unusual fatigue, indigestion. The event passes, life continues. The only record left is in the nail. I had a patient named Harold who came in for something entirely unrelated, a routine follow-up that had nothing to do with his heart. I noticed a clear horizontal groove across nearly all of his fingernails. Not a subtle mark, a visible, palpable groove. I asked him about it. He paused, genuinely unsure what I was referring to. When I showed him what I was looking at, he ran his own finger across the nail and felt it for the first time. After some thought, he recalled being very seriously ill about 4 months earlier, what he had assumed was a particularly bad flu. He ran a fever. He was exhausted for nearly 2 weeks. He rested, recovered, and moved on. He had told nobody about it because he was certain it was just a virus. We ran some tests. He had experienced a silent heart attack. His Bose lines told the story his symptoms never did. Without those grooves, we might not have known for years, if ever. Now I want to shift to something you can check directly underneath the nail surface. These are called splinter hemorrhages, and they look exactly as the name suggests. Look beneath your nail right now, not on top of the nail, through it. Do you see any thin, dark lines running vertically, like tiny splinters trapped beneath the nail? Those are small collections of blood in the nail bed capillaries, tiny hemorrhages in the smallest blood vessels under your nail. One splinter hemorrhage on one finger after bumping your hand means nothing. That is normal. But multiple unexplained splinter hemorrhages across several fingers with no trauma to explain them, that requires medical attention. In medical training, unexplained splinter hemorrhages across multiple nails are associated with infective endocarditis, an infection of the inner lining of the heart's chambers and valves. Bacteria enter the bloodstream, attach to damaged heart tissue, and tiny clots break off and travel to the small vessels in your nail bed, leaving those dark vertical lines behind. Infective endocarditis does not get better on its own. It requires urgent evaluation and treatment. I had a patient named Phyllis who noticed these dark lines on several nails and mentioned them almost as an afterthought during a visit about something else entirely. She was diagnosed with a heart valve infection caught in time to treat effectively. She told me afterward she had almost not mentioned it. She genuinely thought it was nothing. Please do not make that call on your own. When you see multiple unexplained vertical dark lines beneath several nails, mention it that week, not in 6 months. The sixth sign involves the lunula, that small whitish crescent shape at the base of each nail. Most people think of it as just a cosmetic feature. It is actually the visible portion of your nail matrix, the active zone where new nail cells are being generated every single day. And its color is one of the most overlooked diagnostic signals on the entire body. Look at the base of your nails right now. What color is that crescent? A reddish lunula is significantly associated in research with valvular heart disease and congestive heart failure. A bluish or purplish lunula suggests problems with oxygen delivery in the circulation. And a lunula that has faded to almost nothing, very pale, barely visible, is often a sign of anemia. An anemic heart works significantly harder to compensate for reduced oxygen carrying capacity, and that extra workload creates its own cardiovascular strain over time. All 3 of these color changes deserve medical attention, and all 3 can develop so gradually that you genuinely stop seeing them. Dorothy was 74. Her daughter, who happened to be a nurse, visited one afternoon and noticed that the half-moon shapes at the base of Dorothy's nails had almost entirely disappeared. Dorothy had not noticed at all. The change had been so gradual she had adjusted to her new normal without realizing anything had shifted. Her daughter encouraged her to bring it up at her next appointment. We ran a blood count and cardiovascular workup. Dorothy was significantly anemic and showing early cardiovascular strain. Both were caught and treated before anything serious developed. Her daughter spotted it sitting across a kitchen table in ordinary afternoon light. Someone in your life might do the same for you, if they know what to look for. Which is why sharing what you are learning right now matters more than you might realize. Now I want you to actually do something while you are watching. Not later, right now. This is called the capillary refill test, and it directly measures how quickly your smallest blood vessels recover from pressure. It takes 15 seconds, and what it tells you about your circulation is genuinely remarkable. Hold your hand at heart level. Press your thumb firmly on one fingernail for 2 full seconds. The nail bed will go pale as blood is pushed out. That is normal. Now release and start counting. Watch the pink color return. Count how long it takes. In a healthy adult with good circulation, the color returns in under 2 seconds. If it takes 3 seconds or longer, test 3 or 4 different fingers, then the other hand, and you get the same slow result across multiple fingers and both hands. That is a meaningful signal. Your microvascular circulation is sluggish. Research has linked persistent slow capillary refill in older adults to reduced cardiac output, undiagnosed atrial fibrillation, and elevated stroke risk. These are conditions that build quietly for years and then produce a catastrophic event with very little warning. Do the test now, in a warm room with warm hands. Cold temperature slows refill on its own. Make sure your hands are warm, then press, release, and count honestly. I want to tell you about Walter. One evening, Walter tried this test after hearing about it from someone who had watched a video like this one. He pressed his thumb on his index finger, released, and started counting. He got to nearly 5 seconds before the color came back. He thought perhaps he had pressed too hard or not held it long enough. So he did it again. Then he tested his thumb, his middle finger, his ring finger. Then he switched hands and tested every finger on the other side. 5 seconds, every time, consistently slow across both hands. He did not panic. He did not dismiss it. He wrote down what he had found. He called my office the following morning and described exactly what he had seen, finger by finger, hand by hand. He was calm, clear, and specific. We brought him in and ran a full cardiovascular workup. We found undiagnosed atrial fibrillation, one of the most common and dangerous causes of stroke in adults over 60, and one of the most treatable when caught early. He was placed on appropriate treatment. Based on everything we know from current cardiology literature, that call very likely prevented a major stroke within the year. Walter had no other symptoms, no chest pain, no shortness of breath, nothing that would have sent him to a doctor on its own. Just slow capillary refill on a quiet evening at home. Now drop your number in the comments. How many seconds did it take? 1, 2, 3, 4, 5? I read those comments. If you are consistently seeing 3 seconds or more across multiple fingers, please do not brush past that. Here's what to do with everything you have just learned. Start today. Take both hands to a window with good natural daylight. Look at each nail one at a time. Check the nail bed for any bluish, purplish, or unusual pallor. Look at the tip of each nail for a narrow reddish band. Look for horizontal white lines you can see but not feel. Look for deep horizontal grooves you can both see and feel. Look for tiny dark vertical lines beneath the nail surface with no trauma to explain them. Examine the base of each nail and note the color and size of the crescent. Then run the capillary refill test on at least 3 fingers on each hand and count honestly. Write down what you find. Take a photograph of both hands in natural light today. Do it before anything else after this video ends. These changes are gradual, and your memory adjusts to them without you realizing it. A photograph does not. 6 months from now, that image will show exactly what was there today. No adjustments, no rationalizations, no blur of familiarity. If you find one sign, mention it at your next routine appointment. If you find 2 or more together, do not wait. Call your doctor this week. Describe what you observed. Ask whether you need to be seen sooner. And please do not use any of this to diagnose yourself. What these signs do is give you a reason to have a specific, informed conversation with your doctor. The full clinical picture, your history, your medications, your other symptoms, is what produces an accurate diagnosis. Your job is not to diagnose. Your job is to notice, to document, and to speak up. That is the part most people never do, and it is the part that makes all the difference. Earlier, I asked you to drop your age in the comments, along with your family history. Here is why that matters. If you are over 65 and have a first-degree relative who had heart disease, your baseline cardiovascular risk is meaningfully elevated, even without symptoms. If you find even one of these signs today, the bar for calling your doctor should be lower than for someone with no family history. Do not wait for something dramatic. These signs exist precisely because dramatic is what happens when the quiet signals are missed. Your nails have been sitting at the end of your fingers your entire life. Every single day, through every decade, through every season of your health, they have been recording how your blood moves, how your heart works, what your smallest vessels are doing. The biology has been running the whole time. The monitor has never gone off. It has been on, quietly, patiently, leaving its record in plain sight. The only thing missing was someone telling you how to read what it has been recording. You have that now. Use it. Share this with someone you love, not to scare them, but because it is one of the most genuinely useful things you can put in their hands today. The next person who watches this might look down at their fingers tonight, recognize something, pick up the phone, and change what happens next for their family. That person might be someone you care about deeply. It costs you nothing to share it, but it could mean everything to them. And if this kind of content is useful to you, the signs your body sends before something serious happens, the research that supports them, the conversations with your doctor that can actually change outcomes, then subscribe. I cover this every single week because I genuinely believe that the gap between what medical research knows and what patients are actually told is one of the most preventable problems in all of healthcare. Every person who watches this and acts on what they learn is one fewer person whose warning signs went unread. That is what matters. Closing this gap is exactly what I am here to do. I will see you in the next one.